Sorting webinar. My name is Barry Stokes, and I'll be your moderator throughout the session. Thanks very much for everyone for joining us today. Our presenter this time is Tricia Barrett, Vice President for Product Development at NCQA. Throughout the presentation today, I wanted to go through some administration points. The presentation will be lasting between 15 and 20 minutes, and it will be followed by a brief question and answer session. In the actual session itself, you can ask a question in the console, in the question console in the WebEx online, or towards the end of the session during the Q&A, you can use the raise your hand icon and I can unmute your line so you can ask your question directly to the presenter. And finally, we'll be asking you to submit any further questions you may have directly to us here via email, so we can answer those on a podcast that we'll be producing after the session and sending out a week later. So you can submit your questions to gehco@vlife.com or gecko@vlife.com. So without further ado, I'm going to hand over to Tricia Barrett, the speaker for today's session.
Thank you, Barry, and good afternoon, everybody. I'm delighted to have the opportunity to talk with you today. I hope you'll find this information useful, interesting, and really do encourage your questions. So we're going to talk a bit about the health appraisal and how important it is in the context of overall wellness programs. And NCQA has an accreditation program and certification program for wellness and health promotion, including one that is specific to health appraisal tools. So I'll have the opportunity to talk a little bit about that as well. So, I actually just covered this. So we think that this is an important tool that really is central to anyone's wellness programming, and that by having a certification, the vendor is demonstrating their commitment to having an excellent product available to you. So NCQA, we are a private nonprofit organization. We have been around for 23 years and began as an accreditor of health plans. Looked at the managed care industry and how it can best contribute to the quality of healthcare in America. We have expanded substantially from that beginning in the health plan world to cover really many principles of population health management, including this area of wellness. We began our work on the wellness and health area. We kind of used this chart that you see now, this bubble chart, that really sort of depicts how we think healthcare should work, what the best approach is to addressing populations at the various points in the spectrum, and that the more we can focus attention on the healthy, low-risk population, the more likely it is we'll be able to manage healthcare costs and the health outcomes that we are hoping to achieve. So, we think that employee wellness programs are really important to the overall healthcare system, that people are at work a big part of their time, and that by having a really strong wellness attention or culture within an employer's organization, we'll have a much better opportunity to influence the behaviors and the health of the population than if that is a sort of wellness-free zone. So we care about the subject of wellness and health promotion for a variety of reasons here at NCQA. When we started this work back in 2007, most specifically, and that included things like the costs of care continuing to rise, and that this is unmanageable, that we need to address both the direct costs of health care, but also, and very important in the wellness sector, the indirect costs associated with it. So the productivity and engagement of a workforce with their work environment is critically important. In fact, where many of the savings can be reaped, and that a challenge in our healthcare system, at least here in the U.S., is that there is this laser-focused attention on the direct costs of healthcare, and maybe less so the attention to these indirect costs that, in fact, are where many of the benefits of health interventions and medical interventions can be accrued. And so it just makes it for a difficult situation to determine who's really going to care about a particular subject and make sure that it is attended to. That by making investments in workers and having them help to stay healthy, we can also improve their out-of-pocket costs, because there's been such a shift of the costs of healthcare as it's become less and less affordable for employers to cover larger percentages. Employees are actually experiencing those out-of-pocket costs, so they become more invested in their health as time goes on here. And that's stress, and a very important issue that really creates problems for the workplace, and that we need to see employers offering wellness programs as an opportunity to really engage with employees and have it be kind of a perk of employment, so with retention. We were building our program. We were looking at what was out there in the wellness community to help with identifying strong programs. So in that process, we found that there were many organizations already out there providing support and awards to employers directly for their good works in these areas, and I've listed several of those here. I think I've put them here for reference. If you're not familiar with them, they might be things that you'd want to look into to have a better understanding of how you as an employee might want to benchmark your performance in terms of the kinds of offerings you're providing to your employees. But it also points out a reason why NCQA did not approach it from the angle of the employer and accrediting or certifying employers' wellness programs, but rather we take the approach of looking at the vendors or your partners in the wellness programming space in order to provide a tool for you as an employer to use in selecting who would be the best partner for us to work with for the programs that we want to put in place. So some of the key principles used when we were putting together the program, we identified conditions or topic areas that were showed in the evidence to have the best opportunity to have an impact on health, wellness costs, both of care and these indirect costs. We talked with stakeholders of various types, including direct to consumers, patients, employees, to businesses, employer groups, and of course the industry to understand what was the state of the art, and researchers who were really looking at what are the features that are most tied to success. We did find that management needs to be actively supportive of wellness programs, and we had our top management at NCQA really actively engaged in this particular subject because it was near to our hearts. The communication that is done with wellness programs, we found in the evidence that the more tailored it can be to the demographics and communication styles of the company, organization, and the individuals that make it up is critical, and so there is flexibility and expectations for having a variety of means of communicating with employees or customers in standards that we've put together. That the programs that are the wellness program can be integrated with other programs better because we need to think of people in holistic ways, and if you're coming at them from many different angles, while that'd be a useful way to draw people in for beginner engagement, you really need to have convergence so that they're not continuing to get bombarded with messages from many different points of contact. You want them to get their messaging to have some logic to it. that when we've seen successful programs, they tend to have a really strong branding with a corporate value proposition. And what I mean here is that it's kind of to the culture of wellness and the idea that the organization, that the employer that is working with a vendor or partner really needs to own this in a real way and have it be really clear to the employees why and how and so forth they should be engaged with the wellness programming. So I've given you, some thoughts about, we've talked with companies and the wellness program, what seem to be the key features or points that were important as they were getting themselves started. And so we've laid those points out here. So if I were developing a program, if I was an employer like you and was trying to put something in place, I'd want to see what are the most important topics for my population. I'd want to see what other employers are doing, so some of those references that I provided on a prior slide. I'd want to talk with my employees and understand what really matters to them, what they see as the barriers to them being healthier and living a healthier lifestyle. You'd use that prior information that you've gathered to kind of test case or design, an initial thought of how this program might look, and then really work with your employees to make sure that it's something that they think will resonate for the environment that you have. And then you're going to want to look and see who can partner with me. How can I do this work effectively? And there are, a number of organizations that are able to do that. And, a key thing to think about is, has this organization that I'm thinking about partnering with, have they committed to having a quality product by something like an NCQA certification or accreditation? So, next thing is you'd want to think about what kind of incentives you might want to offer, how your teams of people work well together. Is competition going to be a healthy thing within your organization? That kind of thinking needs to go into it. And I think, as it was said on the prior slide, you really want to think of incentives probably as a gateway, but not, if they build an inherent design for quality, for their quality of life and lifestyle activities, it's not going to continue to be effective. You'll have to keep upping the ante and those incentives to have engagement continue. So it's really just a way, a foot in the door to get things started, and you might want to think about how are you going to sustain the engagement of the population across time best within your organization. So that your senior management is on board. Again, when everybody that we talked with, critically important to the success of any wellness program is going to be the engagement of the culture and the organization from the top down throughout the organization. And so it's very important that be an aspect of what you think about. You'll modify your design of your program based on the sort of tested piloting that you did along the way, and then really can't be said enough that communication is critically important, that you need to keep messaging, keep being consistent about that messaging, and then keep updating it and making it fresh over time to assure that you keep getting people engaged and involved. So, just a little bit on NCQA's program. We have an accreditation program for wellness and health promotion organizations that is comprehensive. But then, as we looked at it, there are certainly a number of key areas where there are specialty vendors who really focus their attention in a particular place and therefore perhaps bring best-in-class tools available to either within these larger comprehensive wellness vendors or direct to the employers who are pulling their programs together with a combination of internal resources and best-in-class vendor support. And so obviously the topic today is related to health appraisals, and we have 16 organizations that have had their health appraisal certified. The next slide is just going to go over what those elements are. So when we looked at health appraisals and the state of the industry in 2008, and then have continued to monitor that over time, there certainly is a lot of variation in exactly what's included in health appraisals and exactly how they're administered, and we wanted to take from all that variation what are critical features that seem to make them most effective. And so those are the kinds of things that we ask about in our program. So for example, you need to include questions on specific topics so that that information is made available. Things like the demographics and health history of the population or the individual, their self-perceived health status, and preparedness to make change. So do they feel like they have the strength and ability to address a particular health area that they might have? This helps with your targeting efforts, that you can work with people where they are, help move them towards readiness to change if they aren't there today. But if they are there, then make sure that you target your messages effectively. So it's pretty important. Really, the first step in any wellness program is to put in place a health appraisal, have an understanding of the population, and make sure that you are going to be able to target your interventions effectively. There are a certain subject matter, so the HA scope on this slide, so item C, is maybe that key topic areas are addressed, and there certainly were many more topics we considered and could have included, and we know that there's many health appraisals that do include additional topics. The ones that we selected as sort of primary importance is related to weight, height, smoking, physical activity, health eating, stress, activity or absenteeism, so something relating to how much is your health affecting your ability to work effectively, cancer screening items and other preventive services, and then topics related to drinking and depression. We, like I said, know that there are many other topics that could be included, and we also acknowledge the autonomy of the employer to make decisions about which topics they want addressed. But our expectation is that anyone certified has ability to include, has questions within a template health appraisal that do cover all of these topics. And making sure that there is a mechanism for feeding back results to the participant, so the person that filled it out, to really assure that they're able to interpret the information that's provided. So it's a nice, easy to understand report that explains their health risks and gives them the beginning points of actions that they might take. And then, of course, from there, it's a matter of building it out to tailor it to the environment that you have and what other programming opportunities there are for an individual to address a particular health risk they may have. I noted earlier on that it's very important that we address people in ways that are meaningful to them. And so having the health appraisal in a variety of different formats be important, because some people just don't take to doing things online. Others would balk at having another piece of paper to fill out. So whatever makes sense for your environment, a certified vendor should be able to supply it. Making that it can be done at a certain frequency, and then that there is a thoughtful and current update process. So a way of making sure that the information included is up to date. Strong, favorable response to having a certification available here, and we, from our customers, those that have achieved certification, that they get some good value from it, being able to sort of point them out as stand apart from the crowd, from assuring that it creates a market differentiator, and that those who are looking to purchase the services of the vendor have a ready list of qualified candidates. So that was what I wanted to cover today, and now I think, Barry, we're opening it for questions, right?
We are indeed, yes. So if anybody's got any questions, you can either use the raise your hand icon within the WebEx console or type your question out in full, which I'll read out for you in the Q&A section of the WebEx console. We don't have any questions submitted so far, Tricia, but if I can ask one myself, I'll ask really, how do the NCQA compare to other kind of certified companies out there that do the same as you?
That's an excellent question. There are some, there's at least one other accreditor who does accredit comprehensive wellness programs. I will be honest in saying that I'm not as familiar with what their specific requirements are related to health appraisals. I would say that, NCQA is known to be a gold standard for the accreditation and certification of healthcare organizations, that our processes are very strong as it relates to the development of our content and our expectations. We ensure that we have inputs from a wide variety of stakeholders, that there is good, strong buy-in to the expectations that we put in place. And so, like I said, I can't speak specifically to how the conditions that we're addressing compare, for example, to the scope of health appraisals expected in the competitors' accreditation. But there are sites to send that out, I guess.
Thank you. I've got Nate Barnes from Virgin Health Mines that have asked two questions. The first one was, just to clarify, did you say that there were 16 companies that have achieved certification?
Yes, that is. Last I had looked at our report card, that's what it was. And right. Just so you know, it is available. Our report cards are free of charge on our website at ncqa.org. You'll find those listings.
And Nate also asked if you could talk about the process to achieve the certification as well.
Yes, that's great. So specifically, the certification for health appraisals is conducted in a remote review. The customer, the vendor, will identify that they believe that they could meet our expectations. There's an online, essentially, survey that they complete that answers questions specifically related to each factor that we are looking for, and then need to attach documentation to demonstrate that capability, the function we're looking for. So that can include screenshots if they've got web-based systems, or copies of the health appraisal itself. Obviously, in this case, would be a key document. That policies and procedures, how they make sure that the information is made available readily, what the reports look like themselves. So we're looking at all the details, not just taking the word for it of the individual that's filling out the survey, but in fact look at all the details of the program that's made available, and then making the determination that yes, this the expectation is met. We have a process to ensure that our surveyors, the individuals who are looking at all the documentation, are thoroughly familiar with our standards, with the expectations, and that there's an oversight process to kind of do executive reviews to make sure there is good inter-rater reliability, so that one organism isn't being judged differently than another. And then we have a peer review process, a committee that will make the final determination of certification.
Great, thank you. Thompson from Nuffield Health has asked if you could determine how many of the certified companies you've got reside in the UK.
Oh, now that's a really good question. I actually don't know the answer to that, but there is on our website. I want to pull it while I'm talking to you. I believe that the address of the organization is listed. You have to click on each entity's name. order to do that, I believe. So,
Okay.
but these should be part of what's present there.
Okay, great. Don't think there's been any more questions submitted here. Unless
Okay.
anybody's got any questions, maybe we can start wrapping it up.
Okay.
No problem.
Mm-hmm.
So that concludes this webinar. But before we go, I'd like to highlight some editions that are coming up. And these are the editions of podcasts on industry trends and views that are coming up very soon. Some more additional features on the discussglobalwellness.com website that we have, and a new LinkedIn group that focuses on the corporate health initiatives as well that's coming up. Now, thank you for joining us, and we look forward to speaking with you again soon. Goodbye.
Bye-bye.